Major issues on the work of Dr. Sarvadas and his colleagues at the Jules Bordet, who did this survey together or with some assistance of ESMO, is that, and that impressed me a lot, that actually they sent out more than 500 surveys to clinicians, not only from academia, but also from community settings, and they had an extremely good return of these surveys, more than 90%, which if you had asked me before, I would not have expected, I have to admit. So I think it demonstrates that there are tools there to try to assess how scientific messages or state-of-the-art or guidelines are actually received by the community. So that's, I think, is already a very important message, and it's a good message. We are not definitely sure for whom, what kind of test and what kind of treatment for the matter is actually appropriate. So if an issue scientifically is controversial, you see that also in clinical practice this remains kind of controversial. And overall, what we see in the results of the survey is that the take-up of these new messages is actually not depending whether you are practicing at the university or the community setting or in a private office. And in general, the messages are there, which I think is rather reassuring also for patients. When you ask about the usefulness of standardization, I believe that in principle that would be useful. However, we have to realize that obviously we have different healthcare systems throughout Europe. We have countries struggling with the resources. Probably all countries will be struggling because our treatments get more and more expensive. So I think eventually of the available and evidence-based treatment approaches, patients have to have an equal chance to make the optimal choice. And that means in order to ensure that freedom, you need to guarantee equal access to information. And this is where the healthcare providers have their role. If you educate them and target them with probably individualized educational programs, then you will eventually make sure that patients have the optimal information available for their decisions. So I think what we can learn from this excellent work of Dr. Sarvadas is that we will have to tailor the educational tools and programs to the individual healthcare providers' working environment. And then I would be pretty sure that, I don't know, 10 years from now, if such a survey is repeated, we would see less individual differences. Patients should not depend too much on differences in the medical information of doctors.